Sinus infections bring facial pain, pressure and overall discomfort, which can leave you with your head under a pillow for days. Whether you're suffering through your first sinus infection, or you treat them year after year, Katherine Alatorre, from UnityPoint Health covers 5 of the best sinus infection treatment options, including sinus rinses and other remedies, to help you get relief fast. Sinus infection symptoms. Dr. Alatorre sees more sinus symptoms and complaints in the fall and spring, usually coinciding with increased viral illnesses. But these symptoms, including the color of your nasal drainage, don't necessarily mean you're going to end up with an infection. Most feel if they have sinus drainage that isn't clear, it's a sinus infection, but that's not the case. Dr. Alatorre says, most common cold viruses can also cause yellow or green coloring to the drainage as well. She lists the following as sinus infection symptoms: sinus pressure, discolored nasal drainage, yellow or green, runny or stuffy nose, headache, fever, bad breath, tooth pain, ear pressure. Bacterial sinus infections can last for 10 days or more, don't improve with time and can cause fevers of 102 degrees or higher. Viral infections see improvement by day 6 or so, with a fever only in the first 1 to 3 days. Dr. Alatorre says, how to treat a sinus infection. Think you have a sinus infection? Here are the treatment options Dr. Alatorre says are worth a try. 1. Over-the-counter OTC remedies. Any OTC remedies typically used for colds can also help treat sinus infections, as greater than 80% of symptoms are caused by viruses. Tylenol or ibuprofen work well for fever, muscle aches, headache and sore throat symptoms. Throat sprays or cough drops can help with post-nasal drip symptoms. If you're having trouble sleeping, try a combination cold and sinus sleep medication, like NyQuil. 2. Antihistamine medications. Along the same lines as OTC options, antihistamine medications, such as Sudafed, Claritin, Zyrtec or Benadryl, can also offer sinus infection symptom relief. While these medications specifically target allergy symptoms, sinus infection symptoms can be similar, making antihistamines worth a try. 3. Neti pots and sinus rinses. Neti pots and sinus rinses can be used for any nasal congestion, including from allergies, colds or sinus infections. They help with nasal irrigation and clear sinus drainage from the nose to make it easier to breathe, so you feel less stuffy. They also thin the mucus and allow the natural defenses in your nose to clear the nasal discharge, washing away possible allergens or other irritants. If you use a neti pot, once daily is usually enough, but it can be used 3 to 4 times for more severe symptoms, as long as you're not experiencing any discomfort with use. If you have allergies or chronic issues, you can use it 3 times per week to help prevent symptoms. Dr. Alatorre says, neti pots and saline rinses require sterile water, which can be boiled or purchased. Container will say distilled or sterile. Keep the neti pot clean between uses to avoid introducing bacteria to the nasal passages. Side effects from the neti pot include nasal dryness and, at times, bloody noses, which can be relieved by using it less often or making sure you're using a saline solution. 4. Aromatherapy. Aromatherapy is a great natural treatment for sinus infections. Using eucalyptus, peppermint or other scents can possibly help open up the respiratory tract. These essential oils can be put into some home humidifiers, which will diffuse the scent. 5. Antibiotics. Many patients seek medical treatment sooner rather than later because the symptoms of sinus congestion from a cold, virus or bacteria are all equally uncomfortable. But, since most sinus infections are caused by viruses, it's usually preferred to not use antibiotics for treatment, unless the person has more concerning symptoms lasting longer than 10 days with a fever greater than 102 degrees. Some people do get chronic sinus infections, and there can be rare complications, such as abscesses, collections of pus, in the nasal passages. These are uncommon and are usually more related to the anatomy of the sinus passages than putting off treatment. I would recommend if anyone is concerned about their symptoms to go in and be evaluated. Your doctor will prescribe further treatment, if needed. Dr. Alatorre says. With antibiotic resistance rates climbing, it's important to use antibiotics for sinus infection treatment only when necessary.